Hello there, Mr. Il Yong Park, Sang Seobyun, Bat Iridu Purebatar. In the comments, let me first of all thank the organizers of the conference for allowing me the opportunity to speak at such a prestigious scientific practical conference of Asian scientists. My report is devoted to the use of intravascular ultrasound examination in the pathologies of the pulmonary and coronary arterial vessels. Until recently, in the study of the pulmonary and coronary vessels, we used the method of Dopplerography and angiography. During the last few years, additionally, we have begun to use intravascular investigation that allowed us to significantly facilitate the diagnosis and treatment of patients with vascular pathologies. Method of intravascular ultrasound diagnostics used to clarify the condition of the arteries. With the assistance of this method, it became possible to take images of the lumen, of the vessels, and the morphological elements that form its wall. Intravascular ultrasonography of the coronary arteries allows you to accurately assess the lumen of the coronary artery, as well as the structure of its wall. Currently, intravascular ultrasonography is used mainly to determine the tactics of the treating coronary artery lesions during percutaneous coronary intervention, and to determine the degree of damage in situations when there is doubt about the need for treatment. Intravascular ultrasonography is also useful for evaluation of stenosis and identifying coronary lesions that do not cause myocardial ischemia, for which revascularization may be delayed. This review shows the intravascular ultrasonography technique in modern interventional cardiology. The stenosis of the middle coronary arteries is seen, which is confirmed by angiography. We gave an example of an intravascular ultrasound of the right coronary artery. The stenotic part of the lumen of the vessel due to atherosclerosis is visible on the walls of the vessel, which is confirmed by coronarography data. Indications for the use of intravascular ultrasound examination: quantitative and qualitative assessment of coronary artery stenosis, decision on the tactics of the patient treatment, evaluation of the results of interventional intervention, balloon angioplasty and stenting, early diagnosis of atherosclerosis in patients after heart transplantation, evaluation of the functional ability of shunts after coronary bypass surgery. This diagnostic method has no absolute contraindications, with the exception of the patient's refusal to undergo the procedure. Relative contraindications: technical difficulties during the procedure, critical complicated stenosis, occlusions of the coronary arteries, as well as a small diameter of the vessel or twisty vessels, uncontrolled spasm of the coronary arteries. Technique of carrying out: the initial stages of the study are performed according to the standard method, as with vascular stenting. In contrast to them, a catheter sensor is inserted into the lesion foci. The advantages of the technique. Intravascular ultrasound makes it possible to achieve a comprehensive assessment on the basis of which the question of the tactics of treating a patient with coronary artery disease is decided. Also, this method of ultrasound diagnostics is used after performing stenting to assess the correct installation of the stent. The experience of using intravascular ultrasound in the department leads to the conclusion that ultrasound examination of the coronary arteries at various stages of the operation increases the safety of endovascular intervention, allows to achieve the maximum efficiency of the surgical intervention, and leads to decrease in the frequency of stent restenosis. Intravascular ultrasonography images with the markers for normal vessels diameter and affected artery lumen sizes. Practical value. Assessment of arterial diameter before reversal. Assessment of plaque distribution in the area of bifurcation. Evaluation of reversal results. Substrate evaluation, thrombus, calcinosis. For ambiguous coronary angiography findings. In this clinical case, we can see the patient with aged 58 with ischemic heart disease, stable angina, functional class 3 and 4, post-infarction cardiosclerosis. Bifurcation stenosis of the left coronary artery on ultrasound, figure 2 and 3. At angiography figure at 4. After surgery, we can see the results of the procedure. Ultrasound and angiographic picture after stenting. In conclusion, intravascular ultrasonography control significantly improves accurate diagnosis and determines the degree of vascular stenosis and its localization, which is in turn improves the long-term results through skin intervention in patients with lesions of the left coronary artery branch and complex lesions of the coronary arteries. With the study data, it is possible to assess the functional ability of the shunt and stent. Thank you for your attention.